In 12 states, there are more than 2 million people who should be able to see a doctor but can't.
2 million who might not even know they have cancer because they can't afford to get screened.
60% of these uninsured are people of color, and the vast majority of them live in the American South.
For 7 long years, leaders in these states have made a choice based on politics, not on the health needs of families.
Many of these Americans continue to face systemic racism, discrimination, and stigma.
Which means they are denied the health care they deserve.
Our friends and neighbors are living in the Medicaid coverage gap without access to care.
Including life-saving tests that can find cancer early.
Even though people in these states from across the political spectrum agree that everyone should be covered.
Here, income, race, and where you live
might determine whether you live. This injustice cannot continue, and we know how to fix the problem.
No person should live a shorter, sicker life because of how much money they make, the color of their skin, or where they live.
Congress, do the right thing. Close the gap.
Welcome to the National Newspaper Publishers Association's Let It Be Known. Today, we have the privilege of hosting 2 incredible advocates for cancer research and early detection. Alfonso Gibbs, a prominent supporter of the PSA for Him Act in Nevada, has demonstrated unwavering dedication to advancing men's health initiatives. Early this year, he played a pivotal role in organizing and leading a successful series of men's health events in Las Vegas, Nevada. Joining us also is Sarah Grant, a remarkable individual with a profound personal connection to the battle against cancer. Sarah is a 2-time breast cancer survivor, having undergone a double mastectomy in 2022. Her advocacy extends beyond her own experience, though, as she tirelessly champions for family members who have faced this relentless disease. Today, they bring their voices to Capitol Hill alongside 600 other advocates as Congress deliberates on 2024 federal funding priorities before the September 30th deadline. Their mission is clear: to implore elected officials to prioritize cancer research and ensure that every American has access to proven and innovative early detection methods. This is one that is especially crucial for communities facing disproportionate challenges, particularly Black Americans who bear a higher burden of cancer and face barriers to quality prevention and detection services. Alfonso and Sarah are here to shed light on the pressing need for sustained funding in cancer research, the critical legislation in question, and the deeply personal stories that underscore the urgency of their advocacy. Welcome you both to the Black Press of America and Let It Be Known. Sarah, we'll start with you, the old adage, ladies first. Can you share with us how this personal journey has shaped your advocacy for cancer research and early detection?
Yes, having cancer myself, I tell people don't be afraid to get the cancer, just be afraid to get it late because early detection is the key. And you've got to go for your routine exams and so forth in order to get things caught early because it makes a difference in living or dying. And thank God, my cancer in 2004, it was early. And my cancer last year, 2022, it was early. However, with a mammogram, it only caught the cancer in my right breast. So I was scheduled for surgery in March. And right before surgery, my surgeon decided to send me to an oncologist. And she decided she wanted me to have an MRI. And in having the MRI, it showed something suspicious in my left breast. So I had to have a biopsy. And as it turned out, cancer was in the left breast as well.
Wow. You're such a resilient individual when, the first time is enough for anybody. Then the second time, what's that? To walk us through that, if you will, and how do you maintain that smile that we see?
Well, one thing for sure, my smile will never go away, no matter what I'm facing, because I tell people, if you wake up, you're breathing, you should be happy no matter what's going on. So I don't
Mm.
let anything take my joy from me. Nobody and no situation can take my joy.
Wow. Well,
It's-
we are so happy that you have that joy, that you are a survivor, and that you're here with the Black Press. Let's bring in Alfonso. Alfonso, could you share with us the significance of the prostate-specific antigen screening for high-risk insured men, the PSA for him Act, and how it addresses critical gaps in healthcare for men?
Well, first and foremost, what we want to do is remove any and all barriers for testing. African American men are at 70% higher rates of prostate cancer than white men. And if we test early, there's a 100% chance that cancer won't return after 5 years. So what we want to try and do is get as much, remove as many barriers as we can. Because if we can remove the copays, even though those same high-risk African-American men have health insurance,
Mm-hmm.
oftentimes the copay remains a barrier. So
Yes.
we want to remove any and all barriers, and the same thing with Medicare. So the more men we get tested early, the more men we have that live longer, cancer-free.
It's
Nothing to fear.
I'm sorry, Alfonso. Is a barrier still that we, particularly Black men, we are still either reluctant or to get tested, or are we just not informed enough? Is that are those among the barriers?
I don't think it's a matter of not being informed. I think it's a matter of being afraid and also having access to providers that either look like them or understand them. And at the same time, again, I want to go back to removing that barrier, because I know for a fact that this is something that I do personally, but not all men do. I just had a conversation with a gentleman not 10 minutes ago who is 66 and has never been screened. So we keep our heads in the sand. And unfortunately, the longer we keep our heads in the sand, the closer we are to being buried under it.
Yeah.
So
Wow.
we really have to push early detection. And what we're talking about is a blood test.
Mhm.
We're talking about prostate screening antigen that tests for the cell. So if we get that done early, again, like I said, that means more Christmases. That means more birthdays. That means more time with grandchildren. That means more opportunities for anniversaries. But again, we've got to get past the fear. And I think that when more men talk about it openly and candidly, more men will feel comfortable.
Yeah, absolutely. And Sarah, I want to talk about the caregiver side of this. Someone who has faced the challenges of being a caregiver to a loved one with cancer, what insights have you gained about the support systems needed for both patients and their families during the journey?
You definitely need support for both. And speaking of caregiver, I was a caregiver to my mother who's diagnosed with colon cancer back in 99. And being a caregiver put a lot of strain on you because you worried about them. Then you start to worry about yourself. And in a lot of cases, when a caregiver has put in so much energy trying to take care of that caregiver died before the patient does.
Hmm.
And being a caregiver is not an easy job.
Right.
People think just making sure somebody take their meds and you give them some food or something. It's easy, but it's not. And with my mother, she lived like 20 minutes away from me, and I tried to get her to move in with me. She didn't want to because she had a colostomy bag, which I had to change whenever it got filled. And sometimes I'd go 3 or 4 o'clock in the morning. So whenever she needed me, I had to go. And so at the time I was working, and I told my job I'm gonna have to leave with a drop of a hat sometimes. And if you gonna have issues with that, I'll just quit my job because at that time my mother came first. So being a caregiver is not easy, but all things are possible through Christ. And the Christ in me is so strong. That's why I can face anything. There's nothing too hard that I cannot face.
And
And
and,
I
and
just thank God for it.
And Sarah, the caregiver part, I just want to stick there for 1 second. Obviously, there's a lot of challenges there. You've articulated it already well. Give us perhaps one thing that's a must for a caregiver to be able to be successful in being that caregiver.
You need to take care of yourself first. You've got to make sure your strength stays up, because if you don't have your strength up, it's hard to take care of anybody else. So you have to take care of yourself first, and then the caregiver comes second.
That's sounds like some sound advice, Alfonso. You
If I
wanted to add
may,
to that?
yes, and Sarah, thank you for your resiliency.
Oh yeah.
I watched my mother take care of my grandfather, and I ran a caregiver support group myself. So I know that what you're speaking of is the truth. And we tried, the agency I worked for made it a point to make sure that the caregivers got respite care for their loved
Mhm.
ones so they could take care of themselves. So
Yeah.
your point is well taken.
Yeah.
Yeah,
Thank you.
absolutely. And Alfonso, you played a pivotal role in organizing men's health events
Yes.
this year, probably beyond, but I'm talking this year specifically. But what were some of the key takeaways from those events, and how do they contribute to the advancement of men's health initiatives?
Knowledge is power.
Hmm.
Knowledge is power. But you won't get that unless you're in the room. So the challenge, I think, is getting more and more African American men to come out to events like the roundtable that we had earlier this year, so that providers can speak knowledge to those gentlemen who then go back out and share that same information with their peers, with the men that aren't in the room. So the more we have events like that, the more we can get the word out, and the more people can become more comfortable with what needs to be done. So we've got to just continue to push the information out. It helps when you have providers that look like the population that we're trying to reach. So it's sometimes a challenge finding those providers, but when you have them, then we need to make sure that the community comes out, gathers the information so that those fears and those walls can go away.
Yeah, and it's a lot of fear, right,
Yes.
Alfonso?
Fear and misinformation.
Yeah, and that's where I was going with that. Because there's still a lot of that out there, right? I mean, we
Oh, yeah,
still we still don't have or not we're still not totally educated, right?
correct.
And why is that?
One, again, I use this word because we talked about this in another session yesterday, pipeline. And we've got to, through the American Cancer Society, get the word out using the breadth of experience that the American Cancer Society has, the breadth of relationships with providers.
Mhm.
That's the only way we're going to be able to get this out. And speaking to politicians, like I'm here from District 4, Congressman Stevens Horsford's district, again, speaking out, getting the word out to those that can then reach their constituents. And knowledge, I can't, I'm sorry for repeating myself, but knowledge breaks down. I mean, really,
Yeah,
that's why we go to school, to learn.
yeah,
So we need to take this information out of the research lab and bring it out to the community and break it down in words that they can understand, so that then they can make the changes that are required to save lives.
yeah. And Sarah, as we've documented already, a survivor, but also a volunteer and advocate. Can you tell us more about your volunteer work with ACSCAN? And you can tell us what that stands for, if you'd like. You've been doing that, I understand, since 2014. What initiatives have you been involved in? What impact have they had on the community? Tell us about
Okay. It's American Cancer Society Cancer Action Network,
it. There you go.
which is the lobby portion side of American Cancer Society. Most people think it's one and the same, but it's not. It's two separate things. And we really need to get more people involved with American Cancer Society, CAN. But I got involved because cancer, if it haven't hit your family yet, it's going to. It's just a matter of time. So you or one of your family members is going to be touched by cancer. And we've got to fight hard for things to make things easier because one day the cancer will be eradicated, I believe. It won't be in my lifetime, but it will get eradicated. So it's very important to get people more involved with what's going on. And cancer, when people hear the word cancer, they think, oh my God, the person's about to die. And that's not the case. So
Yeah.
you stick with early detection, you can live a healthy life.
And many, Sarah, are really, they are reluctant, understandably so, to be operated on. I firsthand experience, my grandmother when she passed away some years ago. It was cancer, and her the last time, and she could have stayed with us longer, but she says no more cutting. She didn't want any more cutting.
A lot of older people, they do just get tired and they don't want to have any more, like you said, no more cutting. They just say, let me go. Because they've already lived their full life according to them and they're ready to go. Because you can have a will to live or a will to die. And then once you get in and say, well, I'm through, I'm tired of this, I'm ready to go, that person could probably soon cease to exist.
Yeah.
Because your mind is very powerful.
Absolutely. Alfonso, now I've heard a lot about this radio interview you did. You discussed the legislation and AFC CAN's position. Could you elaborate on the key points that you emphasized there and why they are crucial for improving healthcare outcomes?
Well, again, as I've said earlier, we want to be able to eliminate any barriers because, as Sarah pointed out, if someone in your family has been diagnosed, then it's a pretty strong chance that it's you'd be one generation away from having the same diagnosis, number one. Number two, if they're not tested, they can't be treated. So the cancer gene may be there, but because we don't want to go to the doctor, we don't want to take that test, we don't want to get that screen, we don't want, that's not going to keep you alive.
Mm-hmm.
It'll keep the cancer alive,
Mm-hmm.
but it won't keep you alive. So again, the more barriers we can remove, the more people we can save, the more families we can keep intact. So it's crucial that we remove any and all barriers to testing because right now that's all we have.
And you guys are here in Washington, D.C. It's the Congressional Black Caucus Foundation's annual legislative conference. It's where everyone's in town, all the lawmakers, and celebrities, everyone's in town. And
Speaking of which, with all due respect, I've got to meet with my congressman in 5 minutes.
okay, look at that. Well, then let me ask you this, then, Alfonso,
Yes,
real
sir.
quick. Then, how how receptive is your congressman and others on Capitol Hill been to this cause? How receptive have they been?
Well, I'll say this. My congressman and I are fraternity brothers of Alpha Phi Alpha. So and he's already expressed an interest. The challenge, right? Not the challenge, but what we just need to do is get him to sign on. That's all.
Okay. And Sarah, could you shed some light on the importance of collective advocacy in the fight against cancer? You guys are there, Capitol Hill. Share how this collective advocacy, how important it is. Oh, we lost your volume, Sarah.
Sometimes it's hard to get them to agree with what we want them to agree to. But one thing about us, we're going to keep asking until we get what we ask for because we do not give up. We will not give out. We will keep fighting and keep coming back to Capitol Hill time and time again. And it's very important. You just can't give up. This is a fight to death.
Right,
We
right.
just got to keep pushing And they realize a lot of times they don't get involved because cancer hadn't hit their family yet. But boy, once that cancer hit their family, oh man, they want to jump on board then. And they shouldn't have to wait till it hit their family because it's something that affects everybody anyway. It's in all races, every ethnic group. So we just got to push forward. So we will keep fighting as a collective team. We do not give up.
Yeah, that is it's quite a profound message. We appreciate you and Alfonso. Just before we let you go, uh, in light of your experience and your perspectives, the critical need for innovative early detection, and I know you have to run, Alfonso, but the critical need uh, for these things underscore that as far as uh, early detection methods and how they can significantly impact the outcomes when it comes to cancer.
First of all, I'm not an expert on cancer. I'm just pushing for early detection because we know it saves lives. Hands down, it saves lives. You don't know what you don't know. So until you get tested, you can't. So all we're doing at this point is pushing for the one exam that we know screens and detects cancer, prostate cancer.
Yes, yeah, and this act, the PSA for Him Act, it's gonna it really seen well, it really hones in on addressing the disparities there. Alfonso Gibbs, Sarah Grant, it is a privilege to have you both on. We wish you nothing but success in this continued value. Sarah, if your determination, if your smile is an indication of what's to come, then we all in good shape. Thank you so much
Thank you
for
very much.
joining Black Press, Sarah Grant and Alfonso Gibbs, on an extremely, extremely important topic here. So, folks, pay attention and pay attention to this legislation, to this PSA for Him Act, and we'll bring you some more on this as it develops.